Over the years, I have devoted a lot of time and attention to understanding the challenges of living in our world for those suffering from a mental or emotional illness. When an individual has such a disorder, it almost always affects others. Family members and friends who live with or care about them, or people with whom they work. It is essential that those experiencing difficulty have somewhere to turn. For many people, the best way to seek help is through the services of a certified pastoral counselor. Pastoral counselors are religion-based therapists. Most are ordained clergy. Their training blends the study of religion and theology with methods of contemporary psychotherapy. Since pastoral counselors are normally found through referrals by members of one's own congregation, healing is rooted in one's own religious community. It is never easy to ask for help with difficulties that are very personal. The video you are about to see tells the story of people who have been helped by working with certified pastoral counselors. It portrays counselors and presents information about their qualifications and the services they provide. Most of all, it shows that there is a way to find help.
Is it nothing to all you who pass by? Look and see if there is any sorrow like my sorrow that was brought upon me.
As my depression went into weeks, I began to believe that maybe I had done something wrong, that maybe God was punishing me. And now I know how wonderful it is to be able to say that, and for all the people that have depression to know that there's help out there and there's nothing to be ashamed about, that it's just an illness like something else.
The sufferings of biblical prophets and saints can be compared to the sufferings of people today who experience mental illness, depression, anxiety, or other recognized disorders. The prophet Jeremiah felt alone, lost, hurt. Job was a good man and didn't deserve his pain, but he was tormented nonetheless.
This man who suffered exceedingly, excruciatingly, every possible human hurt, and he first blames himself and wonders, what did I do? And his friends only reinforce that. But finally, in that process of self-examination, he realizes that there was no fault within.
For many people, the best place to begin the process of healing is indeed in a familiar and safe place, in the synagogue or church.
Historically, over the centuries, care and counseling have been a part of ministry. We referred to it in the language of the church as the care of souls. And the care of souls simply implies that over time, every individual faces difficult decisions, difficult life circumstances, and the ministry of the church to them as souls is that they must be cared for.
This is their most familiar and comfortable place. It's almost like an extension of their family. It's certainly an extension of a core identity of theirs.
Most congregational leaders provide some help with personal problems. But in severe situations, a pastor may decide to refer a parishioner to a pastoral psychotherapist. These mental health professionals are usually affiliated with a church and are trained to deal with serious illnesses like acute anxiety or clinical depression.
It does make me wonder
On a personal level, the welfare of any individual that walks into the congregation means a lot to me. Once that person is a regular member of our congregation, I will feel responsible for the welfare of that individual.
Reverend Joshua Rodriguez leads a small congregation in New Jersey. His commitment to church members goes beyond the Sunday service and includes helping people find appropriate professional help when problems arise.
For many of the members of the congregation, there seems to be a cultural element that has to do with the cultural shock that they receive once they come to the United States of America. Many people, as a result, tend to keep their problems to themselves and not want to share their difficulties with someone outside. I believe that people look at the church and they see it as a hospital. I'm in need, I'm hurting, and I need to see a doctor. I'm not a doctor, but I know persons who are. And one of my jobs as the congregational leader is to try to help them understand that by going outside to someone who might be able to give them more help than the help that I can offer, their problems might be able to be resolved.
When Betty Moss fell into a clinical depression, it affected her family, her friendships, her self-esteem. At first, she had no idea what was happening to her.
I suddenly started having an awful lot of trouble getting out of bed in the morning or making any decisions about what to have for dinner, just little things like that. And I realized that that had been going on for several weeks. I didn't like the idea of going to like a mental hospital or a psychiatrist or something like that, feeling that I had something really awful wrong with me. I was kind of ashamed of it.
Betty found help at the church she had just joined. There was a pastoral counselor on the church staff whose job was to provide therapeutic support to church members.
Bill Arnold had come to visit me and my family because we were new members at Second Presbyterian Church. And he also let us know that he was a pastoral counselor. So when I realized how sad I was and how much trouble I was having getting my daily chores done, that I thought, well, I can go to church and find some help there and go see a pastoral counselor, and that will be safe. I would not have sought help anyplace else except from a pastoral counselor at church.
I saw when I visited her that she was abnormally sad. That led me to continue coming back to see her, and eventually she and I together decided that we needed to talk on a regular basis. Her diagnosis of depression came later, after I had been seeing her for some time, and finally we agreed together that this was depression. Very frequently a person who's depressed feels guilty, and they'll often contribute themselves to the thought that they have done something wrong. So one of the major tasks of care is to help these folks know that they matter, that they are cared for, that God's grace is available to them, and guilt and punishment are simply not a part of it.
Bill suggested that maybe I would want to take medication along with seeing him, and that I would need a combination of both. Counseling with Bill Arnold was very rewarding very early along, because he reassured me that I was going through depression. He assured me that I could get well, that it might take a little while, but that slowly I would start to feel better. Hi, Charles. Hi. Happy New Year.
Thanks. Happy New Year to you.
How was the holiday for you?
In most ways, working with a pastoral counselor is a lot like working with any other mental health provider. When it's an individual counseling arrangement, client and therapist sit together, talk, and explore the symptoms of an illness and its possible causes.
The fact is that if you just walked in on a pastoral counseling session, initially you may not see a lot of difference, because a trained pastoral counselor will be using and drawing from a contemporary psychotherapeutic and counseling methodology and technique as a way to interact and engage the client. But if you stayed around a while and you listened and began to observe and to see how the course of the session went, you'd begin to notice that there is a qualitative difference. And that is that the pastoral counselor is fine-tuned to hear those the spiritual value kind of concerns, the belief system of the person, and how those relate to the life problem being presented.
If a mental illness or problem becomes severe, a pastoral counselor can guide a patient to several important options. Sometimes this includes consultation with another mental health provider. This can help verify that an illness has an important biological aspect for which medication may be an appropriate part of the healing process.
I work regularly with a psychiatrist who will evaluate. Sometimes he says, I think we should not use medication right now. Other times he'll say, Jim, this really is a case where I think a little bit of medication will speed up the process, help the person to be able to maintain themselves and go further in therapy.
And that's where it's very important to validate for the parishioner that, look, you're going to need medical attention. I'm going to continue to work with you on what we've been working on. And that helps overcome the stigma that people have about going to a psychiatrist. And it gives a kind of pastoral permission to do something medical.
It's a part figure of
High
another
standards
person.
for educating pastoral counselors are critical to maintaining a high caliber of treatment. Standards for the certification of pastoral counseling services and training centers throughout the United States are established and overseen by the American Association of Pastoral Counselors.
AAPC came into being about 30 years ago with the primary purpose of setting standards for the practice of pastoral counseling and for the development of pastoral counseling centers. So when they say, I am certified as a pastoral counselor, there's a certain amount of assurance that comes with that, that they are competent to do what they say they do.
To meet the AAPC's strict requirements, pastoral psychotherapists must earn advanced degrees, often to the PhD level. Programs include the study of principles and techniques of traditional and contemporary psychotherapy and clinical work, in which students gain direct counseling experience with close oversight from accomplished professionals. But the training of a pastoral counselor also requires extensive exploration of how spiritual perspectives and religious resources can enhance healing and recovery.
We're training our residents and our students to do psychotherapy that's both an in-depth psychological process and also paying attention to the spiritual life of the person that they're with. It's much more a holistic approach to treating someone.
I think that pastoral counseling is very much a part of my ministry. I see it as a specialty. I see it as a gift that I have. I have particular education for it and skill for it. And so that's why before I start my pastoral counseling day with clients, I pray about it because I see God involved in it. Good morning, everyone.
Although a staff minister, Reverend Christine Wiley's central role is as a certified pastoral counselor at Covenant Baptist Church in Washington, D.C.
Well, I am the assistant pastor here at this church, where I preach every Sunday, and I do Bible studies during the week, leading the chapel service where I make connection with the children. I'm involved in a number of programs, so I'm very much involved in the life of the church.
I just realized that I needed to talk with someone who could help me sort out some issues, who could help me understand why I was feeling what I was feeling, and hopefully redirect my energies, because I was seriously considering suicide. And in searching for that person, one of my primary concerns was that this person be spirit-filled, or at least know the Lord, because that was important for me. I just felt that not too many people would understand that. When I found an African-American female minister who also wore the hat as therapist, this was my reaction. That spells relief.
people come to us for counseling because they trust the religious community that they're a part of, and they see us as an extension of it. And they know that we're going to respect their religious tradition, their spiritual journey, and they know that we're a part of this same community, an extension of the same community that they trust.
The church community, the synagogue community, the mosque community is indeed a very good place to begin.
Look at the trials and the tribulations that the Lord went through. He needed people to talk to. So who do you think you are, that you can do it all on your own?
I think the church adds a whole lot to the counseling experience. There's a spiritual dimension that's very important.
It feels very humbling to find myself sitting in a place where persons will share and give of themselves to me, because it's very scary for them that they would take a risk with me. So I guard it with everything that I have. I see it as a gift given to me to be able to do that. And I see it very much as a gift given by God that I've been entrusted with the care of this person.